It's now time for Ask the Expert. Recent respiratory illnesses that started at the end of last year have shown to be persistent with prolonged symptoms.
Yeah, we have Dr. Brian Baer here today to discuss what to do if you are affected. And this thing does seem to be lingering. It's hanging on. It's annoying. What's going on?
Well, I have to report that it's more than likely the less exotic respiratory virus. You know, some of it may be influenza and bacterial, but it's really unlikely. And in light of the fact that this is a very burdensome and costly problem, the real truth is that it's very contagious, so a lot of people have it.
Is that why some people are having persisting symptoms?
There's this virus, for whatever reason, it starts out with a cough and a runny nose. People are tired and they have general malaise. And that usually, the worst part is usually 10 days to 2 weeks, but then it persists because it causes an inflammation of the airways and the nasal passages, and the symptoms just persist.
I think that's what I had. So thank you for diagnosing what I thought it was.
You and everyone else.
Well, I guess it's easy, right? So that was the thing that was annoying to me about it. It just lasted. I mean, usually you get 2 or 3 days, but it was like, and you hear some people saying, you know, a week later, 2 weeks later.
Well, this was the problem with this cold, in that people weren't sure what to do.
Yeah.
So when do I go to you?
Well, we always tell people that if your symptoms persist for longer than 2 weeks, which is ambiguous here, or you have purulent drainage, or you have continued fevers over 101, that it's a time to see your doctor. One of the telltale signs is if you have facial pain, which is indicative that your sinuses are infected. And you know, you want to go and have your doctor rule out if you have pneumonia or strep throat, take cultures, and give you antibiotics if necessary.
So what's the bottom line here? I mean, people still seeing this?
I think it's on the out and out. It's waning, and I think the bottom line is it was likely the common cold, that you should probably treat it with over-the-counter meds, and then if you're concerned about it, that it might really truly be an infection that needs to be treated, see your doctor.
So what do you when we get into these winter seasons, we think we should be in the winter. Today we're in the 50s, the rest, you know, several more days in the 50s. Does that have an impact on the cold season and the flu season?
Charles, you're starting to sound like my mother.
Yeah, exactly.
I would like to say for the story to say yes, it does, but it's unlikely. I mean, certainly I think it's more that there's viruses around, and it's the time of year, and that people are passing them. I think the most important thing is if people really do have a contagious virus, they should stay home. That's hard to do when we all have jobs and things going on in our lives.
And wash your hands, wash your hands, wash your hands.
For at least 2 minutes.
That's right.
I never wash my hands for 2 minutes, but I do think I'm always washing them, and you know, it dries out.
Soap and water.
There you go. Dr. Baer, thank you very much for coming in. If you have a question for our experts, email them at asktheexpert@todaystmj4.com. You can also leave a voicemail. We do have the number right there for you. Well, just